Hello. Welcome to my vlog. Welcome to my class. This is going to be medical ward virtual duty for BSN 3E group number 1 and will be assigned at Maria Reina Xavier University Hospital Station 2B, and of course that will be on a PM shift. But because of the pandemic, we are going to adjust and adapt with changes of our duty. We will be having our virtual duty, and it's going to be a case scenario based duty. So today I will be giving you your case for the week, and I am Joseph Bahian Abang, your clinical instructor for this rotation. So before we proceed to our case scenario, I'll have to start with you with this premise. I am here for you. It's literally my life's work to help you grow. So you can actually abuse me, you can use me if in any way you could, especially for your growth as a student nurse in this university. Before we proceed to the case, of course, it will be guided with the following learning outcome. First, on completion of this case study, student nurses will be able to, first, build knowledge related to the patient's medical experience. Second, continue to develop a comprehensive assessment and monitoring skills. Third, recommend nursing interventions based on case presented. Fourth, define the roles and contributions of student nurses in the care of medical patients. Fifth, justify optimal therapy based on the current understanding of the case. Instructions. So these instructions will be the basis of all submissions of your requirements. So I hope that you're going to follow this one religiously. First, all critical thinking questions presented within or after the case applies to this case study. Responses. You have to create a brief and to the point responses. No flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance. Base all your answers on the data that is presented and do not assume information that is not provided in the case. Please follow the format of your output, especially on its font style, font size, paper margin, and paper size. So I already sent you the format of the requirements that you're going to submit, and it is going to be in Word file. Saved it as PDF file, and submit all your requirements per group on a date specified as its deadline. So when you say per group, it means that only one will submit your requirements. So I'll be requiring you I'll be having someone from your group to send the output to me in my own email address. Send all your requirements via the official email address of your clinical instructor, and it is advised that you will submit all your requirements on or before the set deadline of submission. Let's now have the case scenario of patient CD with pancreatitis. CD is a 73-year-old woman from El Salvador City who is admitted to the medical surgical unit from the emergency department of MRXUH with complaints of nausea and vomiting, with episodes of epigastric and left upper quadrant abdominal pain that is considered severe, sharp, and worrying that radiates through her mid-back. CD stated that the pain started 24 hours ago and awoke her in the middle of the night. CD is an old, retired sales manager who smokes a half of cigarettes daily. The emergency department nurse reports that CD is anxious and demanding. CD denies using alcohol. Her vital signs are as follows: BP of 100/70 millimeters mercury, pulse of 97 beats per minute, respiratory rate of 30 cycles per minute, temperature of 100.2 degree Fahrenheit, or that's 37.9 degrees Celsius, taken via tympanic route, oxygen saturation of 88% on room air and 92% on 2 liters of oxygen by nasal cannula. She is in normal sinus rhythm. She will be admitted to the hospitalist service. She has no primary caregiver and hasn't seen a physician in years. The emergency department nurse giving the report states that the admitting diagnosis is acute pancreatitis of unknown etiology. A computed tomography scan has been ordered, but unfortunately, the CT scanner is down and won't be fixed until morning. However, an ultrasound of the abdomen was performed, and no cholelithiasis, gallbladder wall thickening, or cholecystolithiasis was seen. The pancreas was not well visualized due to overlying bowel gas. Admission labs has been drawn. A clean-cut urine specimen was sent to the lab, and urine was dark in color. You complete your admission assessment and note the following abnormalities. CD is restless and lying on her side in a semi-fetal position. Cerebrovascular findings are skin is cool, diaphoretic, and pale with poor skin turgor. Mucous membranes are dry. Heart rate is regular but tachycardic with slight murmurs or rubs. Peripheral pulses are palpable in 4 extremities. Respirations are rapid but unlabored on 2 liters oxygen via nasal cannula with oxygen saturation of 90%. Breath sounds are absent in lower left lobe, posteriorly otherwise clear to auscultation throughout. She complains of nausea and is having dry heaves. Bowel sounds and are hypoactive. Abdomen is distended, firm and tender in diffuse fashion to light palpation with guarding behavior. Admission laboratory test results. Lipase of 3,000 units per liter, amylase of 2,000 units per liter, alkaline phosphatase of 350 units per liter, ALT-SGPT of 90 units per liter, ASG-SGOT of 150 units per liter, total bilirubin of 2 mg per deciliter, albumin of 3 grams per deciliter, BUN of 24 mg per deciliter, creatinine of 1.4 mg per deciliter, WBC of 17,500 cubic millimeter. During your physical exam, you noted respirations rapid but unlabored on 2 liters oxygen via nasal cannula with oxygen saturation of 90%. Breath sounds are absent in left lower lobe posteriorly, otherwise clear to auscultation throughout. The admission chest X-ray reports reads with small pleural effusion in the left lower lobe. CD eventually falls asleep and seems to be sleeping peacefully. Several hours later, you hear an alarm on her pulse oximeter and enter her room to investigate. You find CD mooning softly. Her oximeter reads 87%. The physician orders a stat CXR, which shows a significant pleural effusion developing in the left lower lobe, with extension to the right lower lobe. The physician removed 200 ml of slightly cloudy serous fluid. Antibiotics were adjusted to provide broad-spectrum coverage for an upper respiratory tract infection until culture and sensitivity results returned. CD is resting quietly with oxygen at 3 liters per nasal cannula, and her respirations are unlabored and regular. Her oxygen saturation reads 96%. It is now 72 hours after CD's admission. Her lab shows improvement. An abdominal CT scan is completed and shows a moderately severe pancreatitis, but no local fluid collections or pseudocysts. No ileus or evidence of neoplasia was noted. BUN is 9.0 mg per deciliter and creatinine is 1.0 mg per deciliter. She has adequate urinary output. Her IV fluids are decreased to 75 ml per hour. Her amylase and lipase levels are decreasing toward normal levels. The physician writes an order to advance CD's diet to full liquids. The afternoon of the 3rd day of CD's hospitalization, she became agitated with tremors, some disorientation, and auditory hallucination. Her pulse and blood pressure are elevated, although her pain has not increased and the pain medication schedule has not changed. You contact the physician with your observations and he orders scheduled chlordiazepoxide, Librium, and social services consult to evaluate and treat for possible alcohol abuse. 3 days later, CD is lucid, tolerating small liquids, and her pain is controlled with oral pain medications. As she becomes oriented and calmer, CD eventually admits drinking 3 or 4 scotch on the rocks daily. You also discover that CD is estranged from her family because of her drinking. The physician advances her diet to low-fat, low cholesterol, and writes orders to discharge that evening if she tolerates the advancement in diet, which she does. The following day, CD's condition improves. She was seen and examined by Dr. EF with orders of may go home with the following take-home medications: Ultram or tramadol hydrochloride, 100 mg OD in AM, Omnipen or ampicillin, 500 mg every 6 hours, Demerol or meperidine hydrochloride, 100 mg OD, hours of sleep, Tylenol or acetaminophen, 500 mg every 12 hours. And that is the case of CD with acute pancreatitis. Let us now proceed to the critical thinking questions. So these questions will be answered accordingly as brief as possible. First, what are the possible causes of acute pancreatitis? Second, if a CT scan is planned for the morning, what orders would you expect? Third, which specific laboratory results point to a diagnosis of pancreatitis? Fourth, which labs are the most important to monitor in acute pancreatitis? Why are they significant? And lastly, what will you include in your discharge teaching with CD? So these 5 questions will be answered, and of course, it is expected that you're going to submit this one after a day. This will be your daily duty requirements. Day 0, so as for the usual setup, day 0 is going to be your case scenario loading. So of course, this case scenario loading is the same as with your patient loading. It means that you're going to go to the hospital every Sunday for you to get your own case. Day 1, you have to submit your GO, SO, DPA, physical assessment, pathophysiology, drug study, nursing care plan. But since it's a holiday yesterday, of course, you have to focus now on submitting this one for today. For day 2, you have to submit your specific objectives, DPA, your survey for day 1 and sample nurses notes, FDAR of day 1 and day 2, and discharge plan. And of course, that includes also your reflective journal reading. And then for your week 1 requirements, of course, you follow the submission, follow the case study requirements. And this will be the case study requirements. First is you have to have a short introduction of your case, nursing health history, physical assessment, anatomy and physiology, pathophysiology, diagnostic tests, drug study, problem lists, nursing care plan, discharge plan, learning outcome, and references. Of course, please follow the APA style in reference taking. Deadline of submission. For day 1, of course, since holiday yesterday, day 1, February 1, 2021, Monday, the submission is 11:59 p.m. So this will be the same as on the succeeding days. Day 2, February 2, since it's actually Tuesday today, Tuesday, that's the deadline is 11:59 p.m. And for week 1, of course, the deadline will be February 6, 2021, that's Saturday, 11:59 p.m. We are all on our own journey, but in this class, we all need one another and will help one another to grow. This will be the lists of my contact details. My email address is jabang@xu.edu.ph. My number is 0931-042-9842. And of course, this has been Yucef, Bahian Abang, at your service to make your best better. To God be all the glory. See you virtually soon. Bye.